Well, the next time I went to her office, she wanted an opinion, I think it was for an implant.
Okay.
On a patient. Well, this patient was one that she had done the periolase on. So I saw all her records, I saw the x-rays, I saw the periodontal charting, and I couldn't believe it.
You were surprised?
It was amazing.
At the results?
It was amazing.
Are you surprised now? I mean, you've been doing it for a while?
Yes, I'm really amazed. One patient told me he felt like somebody had just taken all of his teeth out and cleaned them all and put them back in, and that he just never felt so good.
So how soon did the symptoms go away? The bleeding gums, the bad breath?
It seems to be immediate.
So your patients, I mean, immediately it goes away?
Yeah. Now, they shouldn't have any bleeding at all. During the healing period, it can happen because you get a scab on the tissue, a little bit of a scab, so you could have some bleeding, but that's more a function of the healing
So they go to work the next day?
Oh, yeah.
But in the surgery, the way it's being done nationwide, most of the time?
Typically, most patients want a few days.
Couple days on.
Everybody's different. You know, every surgery's different, but typically people
So
want
oral
a few days
sedation
off.
is what you're using?
Yeah.
And so they don't even remember the procedure?
Right.
I mean, you told me on the phone
right.
they don't even remember. What happened?
But you know, I get different types of patients. Some patients don't want sedation. They want to be right there and know exactly what you're doing.
Does it hurt a little bit?
No.
No?
I mean, you have to get them numb, so it would be no different than getting a filling done. But again, if you don't like that idea, if you don't want an injection or you're afraid of the injection, we can make it so you're not even aware you had an injection.
I've been told one of the problems with these treatments is the patient is left with extreme sensitivity, gum sensitivity.
That is true of traditional periodontal surgery. They do have, their teeth are more sensitive.
Not with the laser?
Not with the laser,
Why is that?
no. Because the idea is that you're not removing tissue. The reason you get sensitivity is because of gum recession. With
So in traditional surgery, you're actually carving out some of the gums?
You may be, but even if you don't, whenever you lay a flap, the studies tell us you're going to lose about a half a millimeter or a millimeter of tissue. So that's the reason that people have sensitivity. Also,
so what are their advantages? I mean, what are the clear advantages with the laser treatment over the surgery then?
Well, the biggest advantage for the patient is there's very little discomfort.
Okay.
They don't have to worry that they're going to be laid up for a few days, and patients love that. Nobody likes having surgery.
Yeah.
Another advantage would be no sensitivity. They don't get the root sensitivity like they do with traditional surgery. They don't lose tissue. Well, with traditional surgery, if you have a periodontal defect on a front tooth, and you go in there, we can fix that defect. We can do bone grafting, we can do whatever and fix that defect. However, you're going to lose some gum tissue, and people don't like that.
So the lasers, that's behind
the laser, you don't lose the gum tissue because you're not taking anything away. You're not laying a flap. So particularly for anterior teeth, it's a huge win-win.
Okay, now you are a specialist. You're
Yes.
a periodontist. And we talked a little bit on the phone about this. I mean, you have a certain a bias that you believe that people should go, because I guess anybody could buy the laser. Any general dentist could buy the laser.
Correct.
But you feel that they should see a periodontist, a specialist. Why?
I think it's better to see a periodontist because that's what we do all day. That's what we're trained to do. Understanding traditional periodontal therapies allows you to look at the laser differently
Okay.
than if you're not a periodontist.
No, but does it cost more to go to a specialist like you?
No, does not.
So ask for a specialist.
Ask for a specialist and ask for the periolaser.
So when they go in, do you see them on the console?
Of course I do. I like to talk to my patients. I answer their questions, and I always tell them, you know, I hate that feeling when I go to a doctor and I walk out and I think, oh God, why didn't I ask them this? Why didn't I ask them that? So I always tell them, look, if you have questions afterward, you can call me, email me. I will always answer your questions. And I've also had some patients, particularly laser patients, because they tend to be more phobic type patients. Sometimes they'll even come in and I won't charge them a second time just to talk.
Just to talk.
Because I want to make sure that they're comfortable, that they understand the treatment and that they're comfortable.
Why do you
with
like
it.
this so much?
This is the biggest excitement that I've had treating periodontal disease in years.
Has it changed your whole
It
career?
really has changed everything. Because the patient acceptance, the knowing that they're not going to be uncomfortable afterwards, it's just really changed everything.
Okay, we're going to take a quick break. We come back, the diagnosis, what they can expect on day one, and just kind of take me through the treatment process.
Sure.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you can expect when you see Dr. Moran. So again, if you have bad breath, loose teeth, bleeding gums, you've got to watch this next segment. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Hot topic today, a new treatment option for people with gum disease. With us we have an expert on the topic, board-certified periodontist, Dr. Moran. So, bleeding gums, bad breath, loose teeth, bright red gums?
Right. Although you can have periodontal disease and not have red gums.
Okay.
So red gums is one of the signs, but after the disease has been around for a while, your body tends to scar. And that scar tissue is not going to be as red.
All right.
So because if somebody...
So bright red gums.
Bright red gums.
Inflamed.
Right. But just so people know, over 50% of adult Americans have periodontal disease.
Is that right?
Yes.
And this is an easy treatment.
Yes.
I mean, they go in, the laser hits here, it kills the bacteria, and you're saying the bleeding stops, bad breath goes away. You're killing that bacteria.
Right.
I mean, it sounds simplistic in a way. And
well,
it is.
There's some maintenance involved,
Okay.
like anything else. I always tell people, it's like changing the oil in your car. I could give you a brand new Mercedes, but if you don't change the oil, eventually the car is going to die, right?
Yeah.
So it's the same thing with any kind of periodontal treatment, that you have to pay attention to the maintenance. So you have to have good plaque control afterwards. That means good brushing and flossing.
All
You
right.
have to see your dentist for cleanings. You have to do everything that you need to do.
And those symptoms go away right away, you say?
Yes.
I mean, in your experience,
when I talk to patients, of course, I don't go home with them and
Yeah.
look, but when I talk to them and I see them at their week post-operative appointment, there's no bad breath, no bleeding.
Do they give you stories? I mean, do they call me? What do they say to you? I mean, it's all done a week later. That's gone. What do they say to you? I mean, do they...
Oh, best thing that ever happened to them. It was their only hope to save their teeth. Because in their minds, a lot of them, traditional surgery was not an option. A lot of them have done that. They did it 10 or 20 years ago, and they're not going to do it again.
They swore they would never do it again.
And I have people come in and say to me, well, I did the periodontal surgery once, twice. Am I going to have to do this again?
Okay.
And I say, no, not if you do everything you need to do. The whole idea is paying attention to the details.
If this works, this laser, as well as you say, and you're involved in these periodontal meetings nationwide, can't whoever this board is stand up and say, hey, this should be the new gold standard way we do it, rather than the cutting and the stitches?
I think it'll take some
will that
time.
happen?
I think that will happen. I firmly believe
I mean, the future
so.
is definitely that.
I think in the next 5 or 10 years, you're going to see this starting to happen. Right now, Ray Yuckna, who's the periodontist who did the research into the Lannat procedure, which is the laser procedure,
Okay.
he's, I want to say it's at University of Colorado or University of Denver. Anyway, in his program, they're starting to teach the laser therapy, but it's the only one in the country.
Okay.
But
Now,
it's happening.
Now, I've had
It'll
dentists
happen.
on the show, and I've asked them, knowing I was going to interview you, generally, and that will say, I don't know, it sounds a little gimmicky. And they don't know much about it, which surprised me. So dentists will watch this show because it's a dental topic. What do you want them to know about this laser? It works?
It works. Tell them to do the research, to look at the patients who have had this treatment done. You really have to see it for yourself. And if you look at the research, another big advantage that I don't know if I mentioned is, traditionally when I see patients at the evaluation appointment, What I'll do is I look around their mouth and we make measurements of the space between the tooth and the gum. And we do that at 6 points on each tooth. We record
this. Is the diagnosis
This is
part.
the diagnosis part. And we look at x-rays. Well, traditionally, when I was doing periosurgery, I had to, at that time, decide what teeth I was going to condemn. In other words, if a tooth is only 50-50, do I want to ask you to spend a lot of money to try to save it? Then I'm going to look bad in another year or two if we lose that tooth.
Okay.
Well, the beauty of the laser is I have a lot of these teeth that are 50-50, some that are 80-20, I think they're going to lose them. However, it's no extra work, and we haven't lost anything by going ahead and doing the laser, because we're not paying additional money for regenerative materials.
So you think you're saving teeth?
So, in other words, we're saving some of these teeth that we wouldn't try to save before.
So early treatment, like anything else, is much better.
Oh,
is
yeah.
that your message as well?
Exactly. You're better
Bleeding
off.
gums, do something about it.
Exactly, because the treatment is very easy early on. If you really just have gingivitis, it's reversible, and it's pretty easily reversible. But as you start heading into periodontitis, it's never totally reversible. What we can do is we can get you to a point where you can clean your teeth well, and you can come in for maintenance, and we can get everything clean that you can't clean.
Great information. We're out of time. Final message. Somebody watching this, they're very skeptical. They have the symptoms that you've discussed. What do you say to them?
I would say call our office. Let me do an evaluation on you and see what your problem is. And we have this great option of the Periolase. If you're a phobic patient, we can do oral sedation. You won't even know that anything happened the next day.
And what do you give them, by the way? After the treatment, what do they take?
Maybe Motrin. And sometimes they don't even need the Motrin.
It's that...
It's that easy.
So they don't complain about pain? They don't say, boy, I'm glad.
No, I really don't get any complaints about pain. It'll change your life and allow you to keep your teeth.
All right.
Give us a call.
I want to thank you for coming on the show. Very good.
Thank
Great
you.
information. You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can visit our website at wellnesshour.com, and you'll probably put this interview on your website as well.
Yes, I will.
And for now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.